The following program is sponsored by Norton Healthcare.
Dr. Cable, call the operator.
Hello, and welcome to Get Healthy. I'm Jean West. If you have 3 people in a room, chances are that one of them will be affected by a neurological or spinal disorder. That's some 1.7 million people in Kentucky and southern Indiana alone. In Kentucky, aneurysms and strokes rank high among those neurological diseases. The establishment of the Norton Neuroscience Institute brings leading researchers and surgeons to Kentuckiana so that you won't have to leave town for treatment.
My name is Shervin Dashti. I'm a cerebrovascular and endovascular neurosurgeon.
Dr. Dashti comes to Louisville from the Barrow Neurological Institute in Phoenix, Arizona. He joins Dr. Tom Yao from Vanderbilt University as the 2 newest members of the 40-plus team that makes up the Norton Neuroscience Institute. They both have similar expertise, which is a rare and unique specialty.
The unique aspect of my practice is that I'm fellowship trained in to do both the surgical treatment of these diseases as well as the endovascular. Surgical means opening up the head and doing open surgery to clip an aneurysm, for example, or resect an AVM. Endovascular is when you go through the arteries, kind of like the invasive cardiologists do for cardiac caths. You go through the arteries, go inside the arteries of the head and neck, and you can actually treat the same diseases in a different way.
Thousands of Kentuckians die from strokes and aneurysms, diseases that have few warning signs. The first one may be the most traumatic, going to the emergency room with the worst headache of your life.
That's why if you show up to the emergency department and say, I had the worst headache of my life, the first thing they do is they get a CAT scan. And if that's negative, they do a lumbar puncture to see if there's any subarachnoid hemorrhage. So that's the #1 presentation.
You have a patient who comes to the ER who's not moving one side, who's not talking, and they come within the window, which allows us to treat them. And what we're able to do now with the technology is go into the vessel and grab the clot, essentially, and pull it out.
Dr. Yao uses his unique training that can help a patient recover from a blood clot right away.
In this particular case, we were able to get the clot out, restore the flow to the brain, and the patient got better, even on the table. And that's perhaps one of the most interesting things that I can do.
Dr. Dashti's skill in treating aneurysms saves lives.
So if you have the aneurysm burst and bleed, and the bleeding doesn't stop in a timely manner on its own, you're not going to survive that event, yeah. So up to a third of people don't survive that. So the people that make it to the hospital are those 2/3 that are actually lucky enough to get to the hospital. And those we need to fix the aneurysm before he actually rebleeds.
Both men chose to come to Louisville for specific reasons.
One of the main reasons I chose Louisville is because the disease burden here is high. I believe it has something to do with the high smoking rate and a little bit of the diet of the region. But there's a lot of vascular disease, not just vascular disease, lower extremity vascular and heart and carotid, but also intracranial vascular disease, aneurysms.
I just saw a very big need for cerebrovascular health care here. There's been essentially a relative paucity of interventionalists here in this region, and because there's so few of us, we looked around and saw that the community needed such services.
My first 3 weeks working here, I treated 9 aneurysms, which is a huge number for a disease that's relatively rare.
And it's our good fortune to have such skills available to us when we need them right here in our community. For more information or to schedule an appointment at the Norton Neuroscience Institute, call 502-583-1697 or 800-NEURO-KY.